So if you get a medical test, you are obligated to get those results immediately, even without your doctor there.
So it can be kind of scary for some of the more serious health results. Joining us to discuss, 9 News medical expert Dr. Payal Kohli right now. Take us through kind of the history of this whole patient portal thing. Back in the day, you saw your doctor and then the doctor called you. Sometimes you had to wait for like days to get a phone call.
Yeah, it's interesting. When I was in training, and I say back in the day for myself too, we wrote prescriptions. We handed you a piece of paper. I used to walk into the patient's room, write the orders on a piece of paper and hand it out. And that was really sort of the 80s and 90s, I would say, was the birth of the electronic medical record, with the idea here being use technology to make medicine more efficient, more accurate, and better. But here's what happened, in my opinion. The technology got ahead of us, and it started sort of taking over on its own. And now patients are getting results in the portal, sometimes scary results, without even the doctor being involved or having any sort of say in it, which to me is a miss.
So I'd heard stories of people years ago, not that many years ago, you go get a mammogram, you're waiting for a result, and you can't get the result for a day or two extra because the doctor's office is slow in processing or finding you. They have to speak to you in person. And that was excruciating for people. And now it might be excruciating in the other way, where you get a result that you may not fully understand, and you run with it mentally.
Yeah, I mean, the idea here was to have this medical transparency. So this bipartisan law passed in 2022 that said, we're entitled to your records, right? You're entitled to your care because you pay for it, so you need to know exactly what's in it. But to the point you're making, Tom, you are not a medical person. So putting it within context, being connected with the resources, trying to understand the complexity of the test result. And I've seen tons of patients calling me over the weekend because a heart scan, which we checked for prevention purposes, came out positive, and it says you have heart disease, and they start panicking, or as you alluded to, potentially a cancer diagnosis or what have you. These are not appropriate to release on the portal without having the doctor sort of weigh in.
Yes, I think on both sides, you can see people waiting, how brutal that is, but also then you get that result and you go to Dr. Google. And I'm guessing medical organizations are not fond of that.
No, so the American Medical Association is trying to lobby, and some states have already done this, ours hasn't unfortunately yet, that the doctor has at least 72 hours to sort of review the results. Because of course we want to get them to you. We don't want you waiting weeks for your result, but at the same time we want to put context with it. So having a few days of a head start as a physician or a medical provider to put the results in context, I think is really important.
3 days can be a long time for a patient if you're really on the teetering on the news.
It's true. So here's my personal take on it, is that it depends on what test it is. So if it's an HIV test or it's a cancer biopsy, that is not appropriate to release on the portal to me under any circumstances. That's a face-to-face conversation, even if it's negative. Second, the result of the test. If I'm sending you a message that your kidney function is normal, your electrolytes are normal, that's a portal message, right? That's an easy one to send negative. But if something is a little out of whack on my blood test, and it doesn't matter clinically, but I start freaking out because I think, oh, it's red, or in the opposite direction, it comes out green, but I'm like, as a cardiologist, your cholesterol is not green, it is red. You misinterpret the results. So there's a lot of misunderstanding that happens. And the third is the complexity of the test. If I'm sending you an MRI of your spine, there's going to be some age-related changes on there. You might see those and think that there's something concerning or something more significant going on.
Very, very short answer here. What percentage of your patients now have already self-diagnosed when they arrive at your office? Is it 100?
No, I would say probably 60 to 70.
60 to 70%.
But I do think they come in smarter. So I like the idea of the portal, but we need to be guarded with it.
There's more to talk about with this. We'll do it the next time we get to visit with you. It's always good to see you, though. Thanks, Dr. Payal Kohli. Of course, you can find more with Dr. Kohli at 9news.com/Dr. Kohli.